Good afternoon. Thank you so much for joining us today. My name is Terry Belcourt. I'm the Director of Nursing Practice here at the SRNA, and I'm joined by Donna Marin, Nursing Practice Advisor. And we also have Tony, our IT support, here in the room as well. Before I start, I'd like to acknowledge that this presentation is being held on Aboriginal land and recognize the strength, resilience, and capacity of the Treaty 4 and Métis people in this land. Today, we're going to talk about the tools for resolving professional practice issues. Donna, Carol Reese, and myself led and really it was Donna and Carol, led the review and revision of this document. It's one of our most well-used, well-referred to documents, and so I'm really excited to share this new updated version with you and along with Donna today. So it's we're looking forward to your questions, so please do put those in. You can add them through the chat or through the Q&A. You'll find both of those either at the bottom or the top of your screen. That will be the way that you can interact with us today, is through those mechanisms. So I think we'll get started. What you see on your screen right now is actually the front cover of our new document, Resolving Professional Practice Issues, a Toolkit for Registered Nurses. And so we're just going to take you through it a little bit and really focus on the framework, which is a nice little, what I think one of the biggest changes with this document was in the revision, was the step-by-step approach and a really nice framework around how it works and how it flows from one thing to the next. And Donna's going to jump in, and we're going to tandem this presentation. So, so again, if there's anything that's unclear, don't hesitate to ask a question, and we'll take those along the way. So the very first thing when you're identifying a professional practice issue is to really think about what's contributing to this concern. Is there an issue that presents a risk to a patient or a client? Or does it conflict with your professional standards and your ability to meet those standards, or your competencies, your code of ethics? So really thinking about those questions and deciding, is this where the concern lies, or is it somewhere else? If it's a risk to the patient or it's a risk to you as a professional, it is considered a professional practice issue. And so then you can move along into step 2, which is to really explore the issue and define either how client safety was affected, or what is going on for you as a professional that you need to have some time to address. One of the things with a professional practice issue is oftentimes it's not something that you can handle or resolve on your own. It's something that you need more people involved with in order to really find a solution for. So that's part of what the next step is about too, is talking to other people and looking at who can help identify what this issue is. We've got a tool at the back. Appendix A is really taking a look at some questions that can help you define a little bit clearer what the issue is. We can take a look at what's contributing to that problem. Is it that people don't have the right education, the right experience, the right competence level? Are there not enough resources? Or is there maybe a legal consideration or an ethical problem within the scenario?
Right, and I just would like to add a little bit to what Terry was saying about sometimes there is an issue, and the SRNA always would promote resolution at the lowest level, but she's exactly right. Sometimes you can try, and you should try to resolve it at the lowest level, whoever that happens to be with. But sometimes in these professional practice issues, when there is a systemic issue that's presenting risk to a client, or it's not allowing you to really adhere to your standards or code of ethics or the agency policies, sometimes you do have to escalate that. This tool is meant to be used either individually by RNs or by a group of like-minded RNs who all identify, hey, you know what, yes, this is presenting risk and it's something that we need to have addressed. And so, as Terry was saying, there are questions within the document and then within the appendix where you can really explore that issue, define how the client care has been impacted, or your ability to adhere to your standards that we require you to uphold is being affected, and then really decide, is it about communication, is it about policy, is it about accountability, or as Terry was saying, legal ethical issues, is it about human resources? So that whole exploration in step number 2 is key to really define what that looks like.
Important to take the time to do that really well and gather as much information as you can. Looking at specific scenarios, getting details around that, when certain things happened, if they were repetitive, different, same issue, but different situations, and finding as much detail as you can so that the root of the problem can really be looked at and explored. So once you've gathered all that information and really identified well what the problem is, step 3 is identifying resources that could be helpful in resolving the professional practice issue. So internally, you might look to your charge nurse, your manager, your clinical educator. You might look to other colleagues, either on your unit or elsewhere, that may have experienced similar situations. If you've got a mentor or you see somebody as a mentor in your professional life, maybe reaching out to them and getting their thoughts. And human resources may also be a support for you. Externally, we have a wonderful team of practice advisors here at the SRNA, and I think we probably take a professional practice issue call daily, if not more than one. And so we're happy to talk. There's always somebody available to take calls. You might have to leave a message and we'll get back to you, but there's always an advisor, a nursing advisor available. The Canadian Nurses Protective Society is another external resource that is really important, and I think not a lot of people know about. Through your membership with the SRNA, you have access to legal advisors through the Canadian Nurses Protective Society. So you can give them a call and see what their thoughts are on a particular issue. You also have your union. So, of course, the biggest union here is the Saskatchewan Union of Nurses, but you might belong to another union as well. And using their processes and seeking feedback from their advisors as well, to look at it from both a professional standpoint and from an employee standpoint is really important. And you might also reach out to the Employee Assistance Program. One of the things that when anybody calls us, we always refer to our standards, competencies, and code of ethics. And that's the backbone of our practice. And often when people are challenged with a professional practice issue, it's because they know that it's not the right thing for them as a professional, but they might not know where that is actually stated in black and white, and that they can use that information to take it forward and explain why they have this concern. It's not a personal thing. It's, this is my professional responsibility and I need to uphold my standards. I need to meet my code of ethics. So we remind them of those and help them explore where in the standards, competencies, code of ethics, their dilemma is coming from. And so using those as resources is really helpful in situations like this.
Yeah, that's a really good point that you make, Terry. And certainly when these professional practice issues happen, sometimes people can feel very emotional about it, because it can be frustrating, it can be frightening, it can be very concerning when you feel that you're not able to uphold the standards that you're required to uphold. There can be a lot of emotion associated with that, and a struggle, an internal struggle, when you feel that you're not giving the care, the best care that people deserve and that you want to give and that you know you should give. And so really being able to kind of extract out all of those emotions and look at something concrete, something that, when you look at the standards and you look at what a reasonable and prudent nurse should be doing, and you look at what's happening in your workplace, it allows you to really kind of say, okay, here's what I am supposed to be doing, here's what actually is happening, and here's how those two things don't allow me to do what I'm supposed to do, right? And so some of those resources that we spoke about, either the print resources or, also some of the resources that you may get from external supports, are really important when you kind of look at what resources are available to me in terms of moving this forward.
Mm-hmm. Yeah, I think awesome points. So after you've got your information, you've found some resources that might be able to help you in this resolution, taking action is the next step, step 4. And it's so important that you do take this step, right? You've got all this information now, you've taken all the time to gather it. So the next step is to take action. So that might be a conversation with your manager. It might be writing a letter to your manager to express your concerns. But whichever way you go, really setting your intention at the beginning, I think, is really important. Coming at it, and like Donna said earlier, always trying to find the lowest level of resolution for issues, always coming into a situation with a clear mind and a good heart, knowing that everybody wants to make things better. I truly believe that nobody goes to work looking to do a bad job. We all want to do the best thing that we can, and we want to do the best thing for clients and patients and their families. So focusing in on that shared purpose, that shared desire to do the right thing, taking your concerns to your manager is that next step of taking action.
Yeah, and Terry raises a really good point. When trying to resolve these professional practice issues, always key to look at, number one, the impact to the patient and patient safety, right? So keeping that in the center and always, looking at that. As Terry was saying, the team wants to do the right thing for the patient and the family, and however that unit looks, and so really being able to keep that as your main issue. Like sometimes we have had people work through this process in the past, and the practice advisors are open not to finalizing a letter for people, but to give constructive feedback on how people are creating something in writing that they're going to present, as part of the suggestion for resolution in taking action. And so sometimes we've had people say, well, I didn't get my breaks, or I, didn't leave on time, and that's the issue. And although those are really important things and employment conditions that are agreed to should be met, when you're looking at resolving a professional practice issue that is impacting patient safety or impacting your ability to adhere to your standards, the focus needs to be on those kinds of things, and maybe leaving some of those employment issues for a different discussion. And although it's important, it's not really probably belonging in here.
Yeah, good points. So when you meet with your manager to really share these objective and detailed descriptions that you have gathered. I think Donna says it absolutely right. Often this raises emotions for people. And so being able to stay objective and stay with addressing the task at hand is really important.
Well, and trying to also come with some solutions or some suggestions on solutions, knowing that whoever you're working with to try to resolve this possibly already has been working on it, or has their own thoughts as well on how to advance the concern now that it's been brought to their attention. And so you want to be part of that solution, definitely, and coming with that solutions focused collaborative approach is really key in this take action part.
Absolutely. You probably have some concrete ideas of how the solution, how the problem could be fixed. And so sharing that with your manager is really important. Also documenting that the conversation happened and making sure that if there's some actions that are going to result from the, hopefully there will be actions that result from the meeting, that those are documented, and who's going to do what is well assigned and understood, so that those actions can happen and things don't get left behind. One thing that I just wanted to note, that if you're communicating with your manager about specific situations regarding specific patients, always maintaining the requirements through HIPAA, using initials in anything that's written. And if you're going outside of that direct line of communication with your manager, so if it's going to the next person above the manager or externally for some reason, to make sure that not even initials are included in that correspondence, because the patient could be identified, and we would certainly never want anybody to be in a position where they've breached HIPAA legislation. So just a little bit of a caution there.
Correct. And there are some appendices that might be helpful. There's some actual tools that have been included in the document in the appendix section. And so those might be helpful as people work through this section as well.
Yeah, I was just looking at the organizational chart in Appendix C, and that one helps you to sort of figure out what that chain of command is in your organization, who your supervisor is, your manager, your director, those kinds of things. What else is in here? Brainstorming tool. So like Donna said, go to the meeting with some ideas. The brainstorming tool helps you look at what's the solution, what's positive things could come out of this, what could potentially be a negative outcome of this action, and then determine which actions are going to be put into place. So we're really trying to give some good tools to help people take action and uphold their standards of addressing professional practice issues in a concrete way.
And I guess, keeping in mind always that our resources need to be applicable no matter what your context of care is. So we have people that work in the provincial health authority within that structure, but we also have people in rural and remote areas. We have people working for private businesses. And so helping them work through what that structure really looks like, especially if maybe they're new to the organization, would be a key process. So that's why the document is set up the way it is.
Yeah. The other thing is this whole process is really built around the nursing process. So we've done assessment, we've done some planning. Now the take action part is really the implementation. And so then the fifth and final step is that evaluation piece, where you look at what you've done and decide whether it worked or not. If the situation is really complex and it's, a system-wide issue, one solution is not likely going to solve the problem. It's going to take many people in many different departments, many different things to make it better. So having a commitment to touch base and see how things are going, see what needs to change, is all part of that evaluation phase of resolution. Maybe the right people weren't involved and you need to bring some other people in to the conversation.
Well, and I think recognizing that sometimes when there is that level of complexity, sometimes it can take a while for those situations to be resolved. But the key, point that we want people to really be focused on is there actual forward movement that appears to be happening, and keeping in mind that sometimes as a manager, you might not be able to share all the details of how that is getting resolved, but you can loop back and say, you know what, I am actively working on it. It's still on my radar. I am, having meetings and advancing these concerns, and so that the employees in the unit realize that there is some progress being made, and I guess possibly you don't get those responses from the manager and you say, hey, you know what, like I'm feeling that this isn't actually being handled or whatever, and you continue to approach it and to work in a collaborative way to say, what can I be doing to help advance this concern, because it still is a conflict for me with my standards, or it's still an issue in my opinion for patient safety or whatever. So sometimes you may have to make more than one approach at it, but hopefully the concern is being advanced and resolution is on its way.
Yeah. And if not, then knowing through identifying earlier on in the process who that chain of command is, who the next person up is, and keeping your manager in the loop all the way along. It might be out of the manager's control to do anything, and they need that additional support from above, and hearing it from somebody else might be the thing that makes it go forward.
And in fact, sometimes that is the way of it. Sometimes managers are doing everything they can to advance a concern, but when there's 37 names on a letter and they're saying, hey, this is an actual real concern for us within this unit, sometimes managers do have that additional support to move a concern forward. So sometimes these things can be dealt with in a really positive way because they have that support moving forward, right?
And we acknowledge that this is, we've laid out a pretty clean process. It looks like you should be able to go from 1 to 5 pretty straightforward. And we know that that's not the case, that it is bumpy along the way. And it takes a lot of persistence to do the right thing and address these issues. And as registered nurses, we are positioned very well to be the person to take that forward. We are leaders in the workplace, and it is our standards, that we do take action and do the best we can to resolve conflict or professional practice issues as they arise.
And I guess looking at the graphic, we've talked a lot about, moving down that line of steps 1 to 5. But if you get, to those first 2 black diamonds there, where, the answer would be no. Does it present a risk to clients? No. Does it conflict with your standards, guidelines, or policies? No. It's not a professional practice issue per se, according to this framework. However, it may be significant enough that it still needs to get addressed in some manner. So if it's an occupational health and safety issue that presents a risk to a staff member, or some member of the public coming in and out of your agency, or something like that, then that still needs to be responded to or referred to appropriately. So there may as a manager, I may be identifying some kind of employment things that, you know, are concerning to me. But when I look at it, it's not presenting a risk to clients. It's not conflicting with the staff's ability to, you know, adhere to their standard guidelines or policies, but it's something that is an employment issue that I, as a manager, would say, okay, it's not a professional practice issue, but I still need to deal with this in order to really address the agreement between an employee and myself or the agency.
Yeah, perfect. So I think that is that's all the content that we have. So we would be happy to answer questions. I don't see any that have come up so far.
I'll just make one more comment about one of the changes to the content. We actually tried to expand some of the content for managers. So we actually included in the appendices a couple of sample responses to professional practice issue letters of concern that you might get. So as a manager, I would expect that somebody would come and deal with me directly at the lowest level, have a conversation with me. However, if for whatever reason people feel that the concern is not getting addressed, and now I've received a letter of concern, you know, as guided through this framework, then I need to respond to that in some kind of constructive, positive, informative way. And so there are some guides in there on how I could structure a letter of response, you know, saying that I understand the nature of the issue, that I am taking it under advisement, that I'm going to take action and respond, or that I, you know, have already done that, or whatever. So that's one of the additions that we tried to make, was so that that's a little more user-friendly and supportive if you're an RN who's managing a unit and get these letters.
Yeah, that was important. That had been feedback that we'd received over the last probably 12 months or so, was that that support for our RN manager members would be helpful.
And we are, I know that it's a little bit aside from this actual tool, but in our toolkit for managers of RNs, we actually are also looking to develop a document that non-RN managers could access, that talks about responding to professional practice issues when they're identified to you. So that resource could be accessed by either managers that are or are not RNs themselves. So that's coming in our development as well, and will be launched this fall.
I don't see any questions. Like I said earlier, you can certainly reach out to a practice advisor if you have questions about utilizing this document, or if you have a professional practice issue that you'd like some support with. You can email practiceadvice@srna.org, or give our office a call and you'll be put through to the advisor that is taking questions for the day. So I think that's it. I don't see any questions. Thank you again very much for taking time out of your day to join us. We appreciate it.
Yes, thank you.
And have a great day.